Okay, I'm Linda Jackson from Fort Wayne's NBC. More importantly in this setting, a proud Carroll mom and Northwest Allen County Schools mom. I'm with Dr. Chris Himsel, Superintendent, and we've been talking about different topics. Right now we want to look at March 13th, everything closed down. And since then, things have really changed quite a bit. How have they changed? And I think safety is number one on everybody's mind, along with getting an education. How are things going to be safe for the kids?
Things are different. One of the things that happened when we did close on March 13th, it was because our medical experts and public health experts, in looking at all the data that was coming up, and there was beginning to have some cases in the Indianapolis area, and I think there may have even been a local case about that same week, was a lot of unknown. We asked the doctors, what is different about the advice to close back in March versus the advice to try to reopen here in July in preparation for August? And they said the main difference is we know more. We just know more information. In March, we did not know how it affected children. We did not know how it was going to affect different biology or genetic makeup. We didn't know if it was going to affect younger people differently than older people, because all of our information was coming from other countries. Now we have our own firsthand information. We have cases here locally that we can learn from. We have cases in neighboring counties and throughout the state that we can learn from. And because of that, what we've learned is, unlike some other illnesses, it isn't as widespread through kids as it is in adults, and that was something that surprised them. We also went to the point where back in March, the advice was heavy, very heavily focused on hand washing, not touching our face, and cleaning and disinfecting commonly touched and frequently touched surfaces. Now we're getting an emphasis on maintaining physical distance, wearing a mask, and that's because they've learned more about how the virus spreads. We still need to maintain clean environments in terms of the disinfecting and cleaning, good hygiene practices, but we also now know that wearing a mask and maintaining physical distance is an important piece of this. So in all of our schools, we are going to be trying to maximize the physical distance we can at all times. Because we can't grow the size of our classrooms or the size of our buses, it's not going to be possible in all cases, which is why we're going to be requiring mask wearing. There will be opportunities during the day, or at least we're going to try to find opportunities during the day, where we can get relief from wearing the mask by creating those greater physical distances. We're going to visit outside when we can. Our classrooms, if the activity is conducive to it and the weather is good, we may go outside for the activity so we can get a break from wearing the mask. But we are going to be wearing masks because we're not going to be able to maintain that physical distance at all times. We are also going to have cleaning procedures so that commonly shared items are going to be cleaned before the use and then again after each use. We're going to have multiple cleanings and disinfectings of those areas and common touch points, lobbies, restrooms, different places like that. And then we're going to have deeper cleanings in the evenings and on the weekends. We're also going to continue to practice good hygiene. We're going to have a lot more hand sanitizer accessible. We're going to increase the number of opportunities to wash your hands. We always teach blowing our nose and how to cough and sneeze with our youngest students. We're probably going to be reiterating that more with our older students and reminding them, and probably teaching a little bit sooner in the year and maybe a little bit more aggressively with our younger students than maybe what we would have done in past years. So it's all those things, but we've even went so far as to have had an engineer come and take a look at all of our HVAC systems and talk about how do we filter the air and how many air exchanges do we have so that the air doesn't get stale and it's constantly turning over. And so we've maximized all of those within the requirements of our HVAC units. And we've always had air quality cleaner than what was required, but we are now going to maximize those filtering capabilities to make it the absolute cleanest it can be, not just being cleaner than what is expected, but being as clean as it is possible to be. And our HVAC units will handle. So those are some things we're doing to try to make it safe, to make it clean. And that's why it's different today, is we just know more. And the doctors have been a great resource to help us understand that.